Hello everyone, I am Prashanthi Suryanarayana. I am the Chief Dietitian of Basavatarakam Indo American Cancer Hospital. As a nutritionist, we see patients undergoing different kind of cancer treatments every day. So try to help them, categorize them and try to help them in whichever way they are able to eat the right kind of food so that they are able to tolerate the stress of the treatment they are undergoing. So the treatment of cancer can be categorized as chemotherapy or radiation therapy or surgeries or sometimes immunotherapy also. So each kind of treatment has their own challenges and it takes a toll on the patient undergoing every kind of treatment. For example, if we take patients undergoing radiation, it could be radiation of any part of the body. Especially challenges we find more is in the head and neck cancers. So the patients who are undergoing radiation, they undergo radiation for multiple sittings, and over a period of time what happens is they have difficulty in swallowing. Before the treatment starts itself, understanding that the situation might worsen, the clinician explains to the patient and the caregiver that inserting through the nose into the stomach would be a better idea so that the treatment could continue without any hindrance, and simultaneously feeding the patient could continue. So these patients are put on different kinds of tube feedings. So what happens is till the patient is able to swallow, they are allowed to, they eat as much as they can and whatever they're tolerating. Once they're unable to swallow, the feeding continues through the tube feeding. So as dietitians in the hospitals, we plan their feeding protocol throughout the day so that we are able to reach the target nutrition every day. So tube feeding would and we explain it to the patient and the caregiver how the tube feeding should be done once they go home, if they go back with a tube, or even in the hospital, care is taken that the nursing staff is trained well to feed the patient through the tube continuously and feed them well. So different kinds of feedings we give them is through different formula feedings we use, the kitchen feeds, the blenderized feeds what we can prepare in the hospital, and whatever we are able to feed the patient through the tube, we do it accordingly. Similarly, patients who are eating orally, the challenges they face is dryness of mouth. Sometimes there is ulceration in the mouth. Sometimes they have difficulty in swallowing. They have distaste. They have a lot of nausea. They could be vomiting. They have GI disturbances. They could end up with loose stools or any different kinds of disturbances. So we try to modify their diet as per their convenience. So what we explain to the patient and the caregiver is that eating is very important and eating right is very important. Importance of a protein intake every day is stressed upon. So we tell them different ways of including protein and calorie dense foods in their daily diet so that they get the maximum amount of energy to sustain and bear the different kinds of treatment they are going to undergo. So we explain it to them that to make their food more dense, even if they are eating little, eat more frequently to maintain, give them a healthy weight goal. At the same time, try to make it more palatable so that they reach their, so that they eat their food, the food which they like, and also meet up their nutrition goals. Adequate hydration is very important. So in case they are not able to drink regular water every day, we ask them to, sip on small quantity of water or small quantity of some soups or beverages so that it keeps them hydrated. And also frequent meals throughout the day is going to help them refuel them with good amount of energy. There are patients who undergo surgeries and post-surgically they are under a lot of stress. So it could be the stress of the surgery, or it could be because post-surgically they are in a lot of pain and they're not able to move around. They refuse to eat the regular kind of food. So these patients are again advised to step up on their protein intake through different kinds of regular kinds of foods, maybe eggs or pulses or nuts or milk and milk products or some kind of lean meat, and sometimes some protein formulations which would help them tide up the gap between what they take and what is their requirement. So any kind of treatment patient is undergoing, it could be chemotherapy, it could be radiation therapy, or it could be surgery. optimal nutrition is very important, and we specifically focus and stress on importance of optimum protein intake. And whatever be the protein intake, we help them recognize them and include them in their daily diet in different forms. So instead of them going into Google search and understanding in a different level, it is always better that a patient undergoing any kind of cancer treatment comes to a registered dietitian or a certified dietitian to understand what kind of food is necessary for them and how to take it optimally so that they are able to reach their nutritional requirements regularly.